welcome to Valley Varieties. I'm your host, April Davidson. Today I have Nathan Critser. Hi, welcome back. It's good to see you. And he's got Critser TCT?
TRT.
TRT, I apologize.
That's okay.
Okay, and so what are you going to tell us about your business?
So Critser TRT is a testosterone replacement therapy clinic for men with low testosterone.
Okay.
And the approach that we're trying to take with it is a different one that we feel has kind of been lost in the 21st century medical jargon, which is that you got to have your foundation. The foundation, if you don't have a foundation, you know, everything will crumble. So what that means is your diet, your nutrition. Are you getting enough sleep? Are you excessively drinking? All these different things are incredibly important, and our goal is to make you not just improve your hormone levels, but also to be overall a healthier person.
Okay.
And also use as little medication as needed. Because that's another problem with today's medical world is, you know, here's a pill for this, here's a pill for that. So even if you have the best medication in the world that you do need, if you don't have your foundation, it's not going to work as well. Or you get one medication, it gives you side effects, you have to take others, and it's just a vicious cycle. My name is Nathan Critser. My father is Dr. Gary Critser, DO. He has been a physician in the Central Valley for over 30 years.
That's amazing.
And how him and he's had his private practice for about 6 years now. I've managed it the whole time. And this was something him and I had talked about doing, was having a specific TRT clinic where, you know, all of the focus could be on that. And I have chronic Lyme disease. My mother has chronic Lyme disease. A lot of our family does. And due to that, that's actually how him and I actually found to learn a lot of information about male hormonal issues, because at an early age, I myself had male hormonal issues.
Okay.
So navigating that, you know, the best way, like I said, the healthiest way, has been, you know, something that him and I, you know, together have worked on specifically. So he's a DO, which stands for Doctor of Osteopathy. And DOs and MDs are trained both as physicians and surgeons. But a DO has a little more training in the body as a whole. Osteopathy is the philosophy of body as a whole. So diet, nutrition, you know, if you don't have that foundation, then the rest of it is silly. You're just doing, you know, these little patches. And some of these things that people are patching up might not even need medication if that, you know, they get sunlight, their diet, you know, is better. Are they getting enough sleep? So that's one of our, like I said, that's one of our biggest things, is that, you know, how many times you go to a doctor's office and they ask you, you know, what's your diet like? Is it well balanced? Do you exercise? Maybe here and there, but mostly it's what's your problem, take this.
Yes. Yes.
And that's just, you know, in our opinion, that's just not good medicine. And health and wellness has become such an emerging industry over the past, you know, decade or so. You see organic places that, you know, you never saw it before, more and more organic, less artificial sweeteners. So I think in general the world wants to go back to the basics. So what we're doing is not just a clinic specializing in TRT, but a concierge clinic.
Okay.
So meaning that Monday through Friday, 24/7, you have constant access to us.
Okay.
So once you're an established patient, you forgot something in the consultation or one of our visits that you forgot to discuss, or we put you on a regimen and after a few weeks, you know, it's not working too well. Instead of having to pay for another visit, as an established patient, you can call us, you can text us, we can do FaceTime. And if you do need a official visit, same day or no later than 24 hours, you will get a visit. So all of our time is being devoted to this, to
That's
helping
amazing.
patients. Yeah. And a lot of, some places you have to pay monthly, and you don't get concierge. With us, you just pay for the visits.
Okay.
The first year is no less than 5 visits.
Okay.
You would come in, we'd go over, again, your diet, your lifestyle,
Yes.
medications you're currently on, because all these things come together, and it wouldn't be right if we didn't look at everything, because maybe there's medication changes that can be made, and maybe that's why you're having some of the symptoms. So it starts out going with the overview and then getting blood work. Blood work has to be done. Even if you're 72 years old and we're both sure you got low testosterone, blood work has to be done.
Yeah.
Always. So it's $150 a visit, 5 visits the first year.
Okay.
Basically to do blood work every 3 months
Okay.
to make sure that everything's going well. But like I said, but the beauty is that you don't have to wait until, your next visit that's in a few months. You can call us, you can text us. It's not a secretary and got to go through this. It's directly to us.
That's amazing.
Yeah.
That's
So
service
it's exactly, it's the kind of service that I know me and a lot of other people would love to have, especially with someone that has gone through a lot of medical issues,
Right.
including these, and psychologically they can
Right.
do a lot of damage, and especially for men with testosterone. Low testosterone can be fatigue, loss of muscle tone, loss of sex drive, brain fog, and especially as being a man, like I said, I understand how not being able to perform is something that can really mess with you.
Right. Right. It really is struggle.
Yeah, and so what we're finding is, and the medical literature supports this, that more and more men, younger and younger, are starting to have the symptoms of low testosterone. And we believe that is due to the toxins and pollution that we have in our world. I mean, that's the only difference between,
Right.
50 years ago and now.
Right.
For people, the healthy diet was healthy diet, then as it is now, these different things. And to quote I had to write this down because I didn't know I know the quote, but I didn't know his exact, what's it called? Not,
Verbiage.
I can't think of it. Okay, he's not a physician, but he is
his title.
Right, his title, yes.
Okay,
I couldn't think of
yeah.
it. Thank you. He is a clinical nutritionist that specializes in biochemistry and gene expression.
That's a mouthful.
It is, yes.
That would be why.
Sean Bean is his name.
Okay.
He lives in Maryland. I forget his exact, the name of his company, but he's someone that we work with who he has also gone into not just TRT, but he's in all of medicine, but TRT also specifically because of his own issues that he's dealt with.
Okay.
And to quote him, in this day and age, we're swimming in a sea of estrogen.
Okay.
BPA, bisphenol A, which is in almost all plastics, is a xeno, meaning chemical estrogen, that leaches into the water, that affects all of us. Estrogen is good for women, but synthetic estrogen like that they were never meant to have in their body is not good.
Okay.
The pesticides, the pollution, PFOAs. There was a movie about DuPont Chemical last year with Mark Ruffalo called Dark Waters, which was one of the biggest chemical producers in the country, DuPont, knew they had this toxic chemical, and they just dumped it in this landfill in the middle of a town. Not that much later, a lot of the residents started getting cancer, hair falling out, all these different problems. And PFOA is what's known as a forever chemical. It is, once it's there, and created,
doesn't ever break down.
it can never break down, and our bodies can't excrete it.
Yeah.
So these are just a few examples, genetically modified foods, all these different things that, like I said, people are starting to become smart to or more aware of,
Right.
is why we're seeing men's testosterone average level is declining, and also younger and younger are starting to have these problems. So we want to go at it at the best way medically that we can, and that starts with the basics.
Okay.
There are foods that are good for everyone, but more specific to a man, as men and women diet, can change a little bit depending on what's going on with them. I have specific needs because I can't, eat a lot of whole food due to my stomach. So we've learned to work around a lot of things that people seem to have problems with. So the second part of the foundation is, are there supplements that you can take, organic nutritional supplements that can elicit, in combination with a healthy diet and nutrition, can elicit some of the effects without actually having to take medication. So, of course, there will be people that, even with a healthy diet, even with a healthy lifestyle, they will still need medication. But our goal is to, instead of jumping right to it, which is kind of the philosophy of osteopathy, is the body as a whole. If someone is depressed, instead of first throwing antidepressants at them, and not that they don't work or they are needed, but we check vitamin D levels. And vitamin D is also, first, it's actually not a vitamin, it's actually a hormone. And it is very, very crucial in the production of testosterone in men. A major natural booster that also healthy fats, how your body actually makes your testosterone is from fats. So some people may demonize fats or think they're bad. Really, it's the quality. If you're eating hydrogenated Twinkies, yes, that's not going to be a fat that's going to help you, and it's going to cause many more issues in your body. But coconut oil, and even though it's high in saturated fat because it's a medium chain triglyceride, it can actually improve people's cholesterol. I'm not advising people with high cholesterol to don't start eating a jar of coconut oil, but do some research on MCTs, medium chain triglycerides, and cholesterol and testosterone, and there's quite a bit of reading. There's a lot of things that my father and I have learned throughout the years, like I said, dealing with my own hormonal issues. And me having a love of weightlifting, that turns into learning about nutrition, learning about supplements, what works, what doesn't. And there's things in the bodybuilding world that I've known for almost a decade now that some of the medical literature is just catching up to, or companies are taking worthless products from 10 years ago, such as a very popular testosterone booster that starts with an N that you'll see on TV. Don't want to get sued, but the ingredient that they have in it that they tout as this amazing thing is actually, it's not. Most 70% or more of people that are going to take that product, it's actually going to raise a hormone called prolactin, which is the hormone that's secreted after sex to tell your body you're satisfied. So if anything, I know when I used it, when my friends used it about 10 years ago, it actually lowered our testosterone. It actually killed sex drive. It did the exact opposite. But the problem with a lot of these supplement companies that just want to make a quick buck, this hasn't been around for a while, let's just rebrand it and it's good. Whereas, me, my father, and a lot of other people in the bodybuilding and fitness nutrition world have known for a decade that it's junk.
Right.
It really is.
Right.
So bodybuilders tend to be, because you learn about your whole body, you learn about how to support your hormones, with your diet and all these different things. Bodybuilders are often at the forefront of cutting-edge medical research.
Okay.
And definitely getting into that, learning from very well-known doctors that are into bodybuilding, other HRT clinics that are into this. I've learned a lot that, like I said, medical literature is just catching up with. So most testosterone is administered as an injection into the muscle. And it's one injection, sometimes once a week, once every 2 weeks. And the problem with that is that it gives you this massive spike into the super physiological levels, and then you get this massive drop. Something like, your hormones, you want steady levels, not steady, super physiological, but steady controlled levels. And one way that we found that is actually, instead of larger injections less frequently, micro daily doses, and instead of into muscle, doing it into body fat. So subcutaneous. You can use a smaller needle. It's less painful. We're finding that some people that are given 200-300 milligrams a week, which is on the higher end for testosterone replacement therapy, we've brought some of them down to 100 milligrams a week, and it's the best they've ever felt.
Wow.
So a third of what they were taking, like I said, smaller needles, not as much scar tissue, less painful, much more consistent levels, less side effects. How men get their estrogen is actually from their testosterone.
Okay.
So when you're doing this crazy spike of your testosterone levels, a lot of that your body is taking and converting it into estrogen. And men, of course, need estrogen. Women need testosterone, but in different levels. As I was saying, the medical world has actually come smart to maybe not the quite more frequent injections, but that giving yourself, doing the injections just under the skin and the stomach fat or body fat, which is subcutaneous.
Okay.
You can use a lower dose and you get steadier levels. You don't get quite as much of the spike, so you don't have as much side effects, not as much estrogen conversion. There's also a hormone called SHBG, sex hormone binding globulin, which actually deactivates a lot of your testosterone, which it is needed. It's not something that you need to not have or crush. Just like any man that thinks he needs to tank his estrogen levels, you're going to have a lot of the symptoms of too high estrogen too. So they came out with the first pharmaceutical testosterone injection made specifically for sub-Q. The first ever came out last year.
Wow.
It's a self-administering, you click it.
Self-doses.
Yes, self-doses.
Okay.
And the subcutaneous, that information, me, other doctors, other bodybuilders, I've been hearing this spoken about for over 5 years. And here we are, like I said, bodybuilders are often on, the cutting edge of medical literature. Here we are that it's even pharmaceutical companies are finally going, oh, this is actually better.
Yeah.
And they're able to use a lower dose. So there's a lot of things that I'd say your average physician doesn't know about, and physicians have to know about many different things. So I would not fault a physician for not having as much information on testosterone replacement therapy. But the good thing about us is that I've lived through it. My father's lived through it. We lived through it. And running his office, we've found a lot of different ways to help people. A lot of his knowledge, being a physician of over 30 years, but then some of my own knowledge because of the fitness industry.
Yeah.
And learning these things, having friends, older friends that are having these same problems, and constantly, reading, researching, guinea pigging, on ourselves these different things. So we have combined probably over 100 years
Yeah.
of me, my father, our own patients, people in the fitness industry, of what really works. Testosterone can often be deemed as this evil thing. It's going to make you angry. It's going to give you heart disease, and these are actually not true. Men with low normal testosterone levels actually are at a significantly higher risk of a heart attack.
Okay.
So it's about finding the balance. Not too low, not too high, finding a healthy therapeutic balance. And we believe that we've developed a very well-rounded approach, and are able to give patients the time and the care. And there isn't a monthly fee like some of these other places.
Right.
And places that are over 3 times the price as ours, you're still not getting the concierge. You're still not getting one-on-one patient care. And also there's a good chance that you're getting it from someone, your advice from someone who hasn't lived through it themselves.
Right.
So that's why we feel Critser TRT is something unique, has the papers, but also the real world experience.
Yes.
To help men deal with low testosterone. The first year is 5 visits. After that, it's a visit every 3 months to check up on blood work. But like I said, you don't have to wait until your next visit. You don't have to pay us for a full visit. You get 24/7 communication with us 5 days a week. And for people even that aren't established patients, any calls or messages left, we will get back to you in 24 hours or less. You can call us, you can FaceTime us, you can text us, whatever is most convenient for you, especially in the world of COVID-19 now. We're there for our patients.
That's awesome.
Yeah. Our number is 862-6558. 559, of course. And by all means, text, call, however you would like that best suits your needs.
Okay.
I think that's.
Do you have a Facebook page or?
Thank you for. I'm a little nervous. I haven't done many interviews. Yes, it is Critser TRT on Facebook. We just have our Facebook and number right now, but as I said, our time has been devoted to this.
Yeah.
And we have the real world experience, and it's about making you as healthy as a person overall, and using as little medication as possible to do that.
That's exciting. So you guys work on the foundation while you're getting that all set up.
Yeah. Foundation first, medication second, not medication first and then maybe foundation.
Yeah.
So.
That's great. Sounds like you guys have a really good concept in order, and it sounds like you guys are offering a lot of services to people, and it sounds like anyone who's struggling with some of these issues, it sounds like you should get a hold of Nathan and his father, and sounds like they're going to take good care of you. So, yeah, get in touch with them. And thank you for joining us tonight, Nathan.
Thank you for having me. We appreciate it a lot.
I love when you come on, so make sure you come on again.
I definitely will.
Thank you so much.
Thank you.
And everybody out there, have a great evening.